I had a patient who was not on optimal hypertensive therapy, and the medical student found out she could only afford $4 worth of pills a month, and so we tried to work into that budget the best medicine we could for her. Tell me about any similar experiences you might have had.
Yeah, our medical students are wonderful at thinking about social determinants, and I think they come to us with a lot of good hearts for sure, and good backgrounds in some of these topics. It's not hard to you don't have to be at Grady very long or anywhere very long to realize how much the social determinants affect your patient's health. Social medicine sometimes seems like an extra thing or more of a softer side, but I think it's one of the key parts of being an effective physician. And we define social medicine as the social determinants of health, health disparities, race and bias and health equity, advocacy for patients, and health policy.
That's great. And how do you run the social medicine elective for the medical students, and you teach the residents also. How do you teach these skills to different trainees?
There's a few some of the things that we do are in the required curriculum now through a course called Community Learning and Social Medicine. And then some of them are exclusively for students and residents who choose to do the elective. But a lot of what we're teaching is, first of all, recognizing that these are important issues that affect people's health. So transportation, food insecurity, all of these different social determinants affect your health, and you need to be thinking about them and thinking about how that context affects your patient's health. So being aware of them is, of course, the first step, and then learning how to ask them in a sensitive way, and then learning how to address them, and that can be one of the harder things. We do home visits during the elective so that students can go and see, and I tell you many stories about home visits that have been very eye-opening and it's amazing how a 20-minute home visit can make up more information than 6 years of seeing someone in the clinic sometimes.
That's really great. What could our faculty do tomorrow or today on wards with their learners to really help them and help the learners move forward with some key social medicine pearls?
I think either modeling or watching students and kind of giving feedback about how to ask about the social determinants is really important. And sometimes, it can be as specific as a social determinant screen. Do you have transportation? Do you have access to food? Or do you worry about running out of food through the month? Questions like that. Sometimes it may be just digging deeper into a problem.
Well, that's fantastic. Thank you so much. I appreciate it.
Oh, one more plug?
Yes, sure.
And if people want to do more than just in their clinical teaching and they want to get involved in this work, either in the med school or the residency or the elective, we're always looking for lecturers and small group leaders and clinicians who are addressing social determinants well in their clinic to have students come and work with. So send me an email.